required public comment. Note, any citizen desiring to address the hospital board should turn in a speaker card to our board secretary. If the citizen comment pertains to an item on the agenda today, that comment will be heard early in the meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, CAP, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Okay, first is the approval of the orders of the day. I'd ask for a motion. A second. Second. All in favor, respond by saying yes. Yes. Opposed? Motion carried. Second one is the approval of the minutes of the meeting of October 18, 2021.
So moved.
Second.
Second.
All those in favor, please respond by saying yes.
Yes.
Item 4 on the agenda today is election of board officers as discussed at the governance meeting. This is our annual organization meeting, and at this meeting, we elect the officers of the board: chairman, first vice chair, second vice chair, secretary, assistant secretary, treasurer, and assistant treasurer. Do I have a motion for the election of that slate?
At this time, I'd like to move election of the following slate of officers for the 2021-2022 board year. As chairwoman, Sharon Wessler Peters. As first vice chair, Britt Reiner. As second vice chair, Sarah Large. As secretary, Greg Carter. As assistant secretary, Jim Meister. As treasurer, myself, Joe DiVirgilio. And as assistant treasurer, Daryl Henry.
Second.
That's all I have.
Do you have a motion?
You have a second?
Yeah, all
That's a
those,
motion.
Second. You have a motion and a second.
all those in favor respond by saying yes.
Yes.
Opposed? Motion carried. Congratulations to the new office holders.
Thank you very much, Jim. I want to thank Jim and from everyone here on the board, if you wouldn't mind, for the great job that he has done to serve this board in his capacity. And I got to step into your shoes. I hope I can do a great job. So, thank you, Jim. So, hello, everyone. Okay, we're going to move on with our agenda now, and we'll have our medical staff reports. Dr. Lichtenstein and Dr. Jefferson, please.
Good afternoon, thank you. Today I'm seeking a motion approval of the 21-22 SMH Sarasota Medical Executive Committee roster, including the medical staff officers and department chairs as elected by the medical staff and recommended by the medical executive committee.
Do we have a second?
Second.
All those in favor?
Yes.
Opposed? Hearing none, motion passes. Continue, please.
Good afternoon. The board has previously approved our MEC roster, but we have already had some changes because of Dr. Garner moving into the Assistant Chief Medical Officer position. So today I am seeking a motion approval of the 2021-22 SMH Venice Medical Executive Committee roster, including the medical staff officers and department chairs as elected by the medical staff and recommended by the Medical Executive Committee.
Second.
All those in favor say yes.
Yes.
Opposed? Motion passes. Next on the agenda, we have our secretary's report, and that would be Mr. Carter, please.
On Monday, December 20th, we have our board meeting. And at 10 o'clock, we'll have the Finance Committee. At 11 o'clock, Mission and Planning Committee. At noon, we will have a closed session of the hospital board meeting. At 12:30, we'll have board lunch and issue a final financial review. And at 2 p.m., we'll have our board meeting. That concludes my report.
Thank you, Mr. Carter. Next, we have our treasurer's report. That would be our treasurer, Mr. DiVirgilio.
All right, thank you. I only have. Bill set me up well on that one. I only have one item today. I move approval of bad debt and charity care for month ending October 31st, 2021 in the amount of $17,968,000.
Do we have a second? Second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Next, we have our financial highlights. William Wojcik, Chief Financial Officer, please.
Thank you. I have the financial highlights for October, and we'll start with total revenue for the system. And I'll point out that October is our first month of the fiscal year, so I won't be going over the fiscal year-to-date numbers as they're the same as the month. For total revenue in the rating agency format, we had total revenue of $110,451,000 compared to a budget of $100,564,000. Looking at total expenses in the rating agency format for the system, $103,347,000 compared to a budget of $96,065,000. For operating income for the system, $7,104,000, which generated an operating margin of 6.4%, compared to a budget of $4,499,000, which we budgeted an operating margin of 4.5%. Going with statistics for the hospital, average daily occupancy, 658 patients per day, compared to the budget of 566. In admissions, we had 3,536 compared to a budget of 3,440. And our average acute length of stay this October was 4.99 days, and last year, October, 4.69. For surgery cases in October, 2,171 compared to a budget of 2,061. And in October, we had 354 births compared to a budget of 319. For outpatient registrations in October, 41,996 compared to a budget of 40,245. And registrations in our two emergency care centers totaled 9,752 compared to a budget of 9,746. And case mix index for all patients, 1.99, and for Medicare patients, 2.06. Mr. Chairman, this concludes my report. Unless there's any questions.
Thank you, Mr. Wojcik. Next, we have our committee reports with Mr. DiVirgilio.
Okay, thank you. As reported earlier, the Governance Effectiveness Committee met this morning after approving the minutes of the committee's June 21st meeting. The committee discussed the board officers for the 2020 board year, the slate of which was passed earlier in this meeting. Next, the committee discussed the board member preferences for committee assignments for the year, and those will be voted on at the December board meeting. Next order of business, the committee discussed the board calendar, and at this time, I move approval of the board calendar for the 2022 board year as recommended by the Governance and Effectiveness Committee.
We have a second? Second. All those in favor say yes.
Yes.
Opposed? Motion passes.
All right, next, the committee reviewed and recommended minor changes to those board policies on indemnity for those acting as part of the system peer, quality, other operation, and other operational processes. Based on that discussion, I move approval of amendments to the board policies on indemnity as recommended by the Governance Effectiveness Committee.
Do we have a motion?
I just moved.
Second? All those in favor say yes. Opposed? Motion passes.
All right, lastly, following that discussion, the committee conducted its annual review of the performance of David Theringer, the system's president and CEO. Based on the outstanding performance of the system, highlights of which included the opening of the SMH Venice Hospital, the Brian D. Jellison Cancer Institute, Cancer Tower, and other major elements of the board's strategic plan, continued national recognition for high-quality care, extraordinary effort, managing the system through the pandemic, record patient volumes, outstanding patient experience scores, and continued strong operating performance, as well as market data regarding compensation for leaders of comparable organizations. I move approval of an 11% merit increase on base salary for Mr. Berger and an increase to Smart Plan Opportunity to 45% as discussed and pursuant to the system's leadership performance appraisal policy as recommended by the Governance Effectiveness Committee.
Second.
All those in favor, please say yes.
Yes.
Any opposed?
I'd like to state that I was opposed to this. We discussed at length the idea of using different percentiles in David's performance. David's performance currently, until after this meeting, is at the 65th percentile, which I was in favor of continuing and increasing the amount of percentage of his incentive pay to the 45%. And for that reason, in the committee, I voted no, and I'm having to vote no now. But David, I think you did a great job. I just don't think you deserve to be in the 75th percentile. But I was in favor of having a larger portion of your compensation tied to incentive. And I'd like the record to reflect that.
So recorded. So, the motion does pass. Thank you. Next, we have the president's, excuse me.
Were you going to mention the other agenda item that was discussed? Or would you like for me to address it quickly?
No. I apologize. I missed that in the script, and I apologize for that. There was one other item that we talked about, and it's on here, and I just skipped over it. No intention. Thank you. The committee also discussed the access to committee meetings through virtual meeting software and whatnot. And there was a motion that was presented, but it failed to have a second. And following the discussion, that item was not recommended to proceed further.
Right, just to comment on that, I had made a motion to open up the committee meetings to virtual ability for the citizens of Sarasota County to observe the deliberations of this board. The only way they can observe it is through this meeting, and this meeting is so short, they really don't see the level of thought that goes in their decision making. But it failed for lack of motion.
A correction to that statement. Any citizen can come to any committee meeting except quality.
that be true, but here we have people
No, sir,
participating
what you said
virtually.
was, the only
Virtually,
time that they could come would be to this meeting, and that.
I stand
is not true.
corrected. They can attend in person. But just as we have staff members attending virtually, I do not see any reason why the citizens of this county cannot observe the deliberations of this body in a transparent manner and done virtually. But it failed because no one said it.
And it's been so noted, so thank you both. Now we will move on to our president's report, and we have David Berender, President and CEO.
Thank you, Ms. Peters. Before I start in my report today, I do just want to thank our immediate past board chair, Mr. Meister. On behalf of all the administrators that work here in leadership, we very much appreciate all the work you've done over the last 2 years and your entire career in board ranks. So thank you so much. It's been a pleasure, my friend. Okay, thank you. And in the same light, Mr. Peters, we very much look forward to working with you, and thank you for agreeing to step up and be part of this team. Thank you.
Thank you, everyone.
Okay, so, and one more thing, just to the rest of the entire board, thank you so much for your kind remarks earlier today. Bit unexpected and very much appreciated and heard. And so I just want to thank you. Truly thank you very much. Okay, now moving on to my normal report here. First page, organizational report card, as we always do, we'll start with that. And we have our 5 different areas that we review. The first being in service, and our goal, goal is having our likelihood of recommending the number of services equal to or greater than 70th percentile, be 8 out of our 10. We did fall a little short this month. We did come in at 6 out of 10. I'll show you the detail on that in a minute. Anyway, we'll just talk about that now. In the people area, we have new hire retention. The percentage of regular full-time employees hired in FY 2022 that are still employed as of September 30th, 2022. We have a goal being at 83%. Luckily, we're at 99.5% because it's the first month. So, we would have to have a lot of people quit to not meet that goal. But so that number will continue to ebb and flow as the year goes down or on. In the quality area, we have our goal of having our infection prevention, which is our combined overall standardized infection rate, less than 0.85. Happy to report we are exceeding that at 0.68. Once again, just to remind the board that 1.0 would be the national average or expected number, so we're already setting our goals pretty aggressively. In the finance area, you heard our CFO, Bill Wojcik, present earlier. We have our goal of having our operating margin be at our budget or higher. Our goal is being the budget being 5.5%. We are trending a little bit higher than at 5.7%. And in the growth area, we have 2 goals. The first being our inpatient admissions and outpatient observations, being at 60,119 for the year. We are trending higher than that after only 1 month at 64,393. And then finally, our outpatient registrations, we have a goal of being 1.125 million for the year, trending a little bit lower than that at 1,096,000. Once again, remember we're in our first month of the year, so a lot more to develop on all of that. So now we're looking at our patient experience report card. Just to orient you, on the left-hand side is likelihood of recommending, and you see the 10 different areas that we include in this. The middle column being what our score was. Next column over is the national median score, and then finally where we try to compare ourselves against the 75th percentile. We did have a couple different areas that came in a little bit short. The inpatient rehab facility, 92, when the 75th is 95. Neonatal intensive care came in at 88, when the 75th is 95. Now, I will tell you, I think we only got 4 surveys back on that. So it's, if you have anything that all five, you would fall below that. So that'll, as we get more of a sample size, that should work out. Ambulatory surgery at 86, with me, and goals of being at 89, and then finally in first physicians group at 92, and we have a goal of 94. So we have some work to do in all these areas. I am confident that we will get there and exceed our goal as we do. Next slide is talking about Joint Commission. Earlier this month, SMH Sarasota completed a rigorous on-site reaccreditation survey by the Joint Commission. 7 Joint Commission officials inspected virtually every area of the hospital and our outpatient facilities. The survey covered more services, square footage, and a greater number of staff than ever before. The survey team had a great deal of praise for staff's engagement, enthusiasm, and focus on excellent care, and we will be reviewing the final report in days ahead as we receive it. The successful completion of this inspection is a tribute to our organization's dedication to patient-centered, patient-safe care, which has never wavered amid many hardships and challenges of the pandemic. So congratulations, really Dr. Fiorita, Dr. Seaman, Lori Lang, Mary, Gary, all of you guys did just a great job. Connie Anderson, I think, is behind me as well. Next slide, the Cornell Family Behavior Health Pavilion takes major strides forward. Sarasota Memorial recently received a $10 million gift from Target CEO Brian Cornell and his wife Martha to support construction of our new behavioral health pavilion. The project is scheduled for completion in fall 2023 and will feature 82 beds with unique units for geriatrics, acute, adult, children, and adolescents. The new facility will promote patient-centered, high-quality care by supporting comprehensive services in one location. And Mason Ayers, who's the president of the foundation, really appreciate your hard work and your whole team's work on making this come around. So thank you. Venice marks the construction completion. Venice has completed the construction, is embarking on a phased opening. Although I think the chair reported we have 89 patients here as of this morning, so I'm not sure how phased you're doing here. Sounds open is what it sounds to me. More than 800 employees have been hired, and another 800 plus providers are serving on the new hospital's medical staff. The Feminist Campus is currently featuring the following: 110 private patient suites, 8 surgical suites, 28 private ER rooms, and a medical office building. So Sharon, I know your team is online with Jean, Jeff, and Steve. Dr. Jefferson, I think you're still online as well. We just, you guys are what made this happen. We just want to thank you from a very grateful community for pulling this off. Congratulations. So New Hospital selects inaugural physician leadership. The SMH Venice recently selected its inaugural team of physician leaders. The 13 physicians who represent diverse specialties in both Sarasota and Venice communities will serve 2-year terms. Dr. Jefferson, who is online, will serve as SMH Venice's chief of staff. Chris, thank you once again for everything that you've done to pull that together. Sarasota Memorial Healthcare System Chief Medical Officer Dr. Jim Fiorita will oversee the medical staffs at both Sarasota and Venice campuses with the assistance of SMH Venice Associate Chief Medical Officer Dr. Kyle Gardner and SMH Sarasota Associate Chief Medical Officer Dr. Joseph C. So we also had an Oncology Tower completed on our campus. SMH Sarasota recently celebrated the completion of its new state-of-the-art Oncology Tower, part of the Brian D. Jellison Cancer Institute. The tower has 56 private inpatient suites dedicated to cancer treatment and recovery, latest treatment and surgical technology, 9 new operating rooms, and a full array of patient navigation, counseling, and support services. Many thanks to our staff, donors, and building partners who supported the dreams, preparation, and work that brought this project to fruition. Lori, Very much appreciate your leadership on this. It doesn't happen without you, and I know you're going to say it wouldn't happen without Kelly Dancer and Kelly Batista, but you guys formed a great team and pulled that off. Thank you so much. So our Cancer Institute appoints a new chief of surgical oncology. Sarasota Memorial has appointed leading GI oncologist Dr. Ken Meredith to serve as chief of surgical oncology. Dr. Meredith, a world leader in robotic surgery and the treatment of GI cancers, will lead Sarasota Memorial's team of oncology surgeons and help provide strategic direction as the Brian D. Jellison Cancer Institute moves forward with future phases. Board certified in surgery and fellowship trained in surgical oncology, Dr. Meredith was recruited to Sarasota Memorial back in 2014 to expand its robotic surgical capabilities and develop a specialty program for people with GI cancers and conditions. So congratulations to Dr. Meredith for everything he's done and well deserved. SMH honors physicians, installs medical staff leaders. The medical staff at Sarasota Memorial SMH Sarasota recently honored 2 physicians for outstanding service to the hospital and the community and installed its new physician leaders for 2020 to 2021 to 2022. Dr. Richard Brown, who is the medical director of Sarasota Memorial's Brian D. Jellison Cancer Institute, was awarded the 2021 Lifetime Achievement Award, and SMH hospitalist Faisal King, Dr. King, was named 2021 Physician of the Year. The SMH Sarasota medical staff also appointed officers for the 2021-2022 Medical Executive Committee, starting, of course, with our Chief of Staff, Dr. Richard Lichtenstein. Richard, thank you for continuing to serve and be here as long as you have. Thank you. Chief of Staff-elect, Dr. Jonathan Hoffberger, Secretary and Treasurer, Dr. Alyssa Schulman, and Sarah Temple, and Dr. Amy Roth, members at large. So SMH physician honored by City of Sarasota. We want to congratulations to SMH's infectious disease expert, Dr. Manny Gordillo, who was recently presented with keys to the City of Sarasota and a special citation by Mayor Hayden Brody. Dr. Gordillo, along with Charles Henry, health officer for Florida Department of Health, Sarasota, received a recognition for their work at the forefront of battling COVID-19 for our community. Madam Chair, that is my report. I'm happy to answer any questions.
Thank you, David. Any questions? Hearing none, welcome their baby into our world. And moving on to the agenda, we have the consent agenda, and there is nothing on the consent agenda to report. So we'll move on to the public comments. Karen, do we have any public comments? No, we do not. Thank you. Next then would be legal matters with Carol Ann Kalish.
Thank you so much. I just have a resolution related to our trauma services. If adopted, then it will be executed by the new board chair today, and then will be filed with the state with regard to this board's support of our trauma and our trauma department. It's titled A Resolution of the Sarasota County Public Hospital Board in Sarasota, Florida. Whereas the Sarasota County Public Hospital District, hereinafter referred to as the district, and its governing authority, the Sarasota County Public Hospital Board, hereinafter referred to as the board, were created to meet and have a long-standing history of meeting the community's evolving health needs, improving access to care, and providing the most advanced treatment and technology, including through the operation of the Sarasota Memorial Hospital, the hospital. And whereas the Sarasota Memorial Hospital is Sarasota County's only nonprofit hospital and is the sole provider of essential safety net services, and whereas the hospital has been recognized repeatedly as one of the nation's best public hospitals with superior patient outcomes and a complete continuum of care, including being the only hospital in the region with Magnet Nursing Services recognition, being regularly included among U.S. News Best Hospitals in the region, and having among the lowest readmission rates in the nation. And whereas the board on February 17, 2015 passed a resolution committing the resources to operate a trauma center at Sarasota Memorial Hospital. The hospital received its provisional certification to operate a level 2 trauma center in May of 2015, its final certification in July 2016, and has continually and successfully operated a level 2 trauma center since that time, treating more than 12,000 trauma patients. And whereas the board is aware of the issues related to the operation of a level 2 trauma center, including the regulatory requirements, the costs, the impact on operations and personnel required, and the impact on the medical staff, and continues to believe and is committed to providing trauma services through a certified level 2 trauma program, and that maintaining such a program is in keeping with the board's commitment to delivering the highest level of care to the widest number of community members. And whereas the hospital's broad scope of services, depth of experience in providing emergency and acute care, including specialty care, location, accessibility, and excellent quality all place the organization in an optimal position to continue to serve as a level 2 trauma center in Trauma Service Area 13. And whereas the hospital's organized and independent medical staff, composed of outstanding physicians, well-trained and experienced in every major specialty, including the specialties critical to the success of a quality trauma program, continues to support and endorse the operation of a level 2 trauma center at Sarasota Memorial Hospital. Now therefore be it resolved that the Sarasota County Public Hospital Board and Sarasota Memorial Healthcare System Administration are wholly committed to ensuring the continued successful operation of their level 2 trauma center by allocating adequate resources and personnel to accept and care for trauma patients. And be it further resolved that the Sarasota County Public Hospital Board is committed to continuing to ensure the availability of financial, human, and physical resources to treat all trauma patients at the level of the hospital's approval, regardless of color, creed, sex, nationality, place of residence, or financial means. And be it further resolved that the Sarasota County Public Hospital Board continues in its commitment to participate in the state regional trauma system and the local or regional trauma system if one exists. This then will be passed and adopted in the regularly scheduled public meeting of the Sarasota County Public Hospital Board in Sarasota County, Florida, this 15th day of November 2021, and it will be signed by Sharon Wexler-Peters and also by David Character, if the board so moves the adoption of this resolution.
Second.
All those in favor, say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you, Caroline. Next, we have other business. Is there any other business that anyone cares to bring forward? Hearing none, we will move on to adjournment, and having completed our agenda, we stand adjourned. And I thank everybody, and I think we did pretty good for this first time out for me.
I know.